International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
This presentation is called Achieving Integrated Care for Older People, What Kind of Ship? And it's a response to a paper by Jill Harvey and others in IJHPM called Achieving Integrated Care for Older People, Shuffling the Deck Chairs or Making the System Watertight for the Future. Jill Harvey and colleagues start from the well-known issue that increasing numbers of people in developed health systems are having to be treated for either multi-morbidity or for complex health problems, very often related to aging and very often long-term problems. She argues that the health system response to these circumstances should first of all start off from a focus on the patient's needs. Secondly, it should be based on co-production, and thirdly, that single organisation or even single sector solutions, so-called, to the question of how to integrate care is really just shuffling the deck chairs on the sinking ship. Two responses which have been mooted are firstly to try and educate patients a bit better, but the co-production approach can also draw instead on narrative medicine. Our study found 5 main integrating mechanisms that impact upon care coordination. The first is to set up referral networks, care networks they've been called, which are systems for having formal referral arrangements for patients in the most commonly occurring care groups, so that there are standing systems in place to enable patients to access the sequence of services, the sequences of providers and the sequence of care that they need as their health problems unfold. Second, and perhaps most important, is the central role of multidisciplinary teams of different professionals, the different professionals involved for caring for a particular care group or individual, multidisciplinary teams which work both within and across organisations and themselves undertake the coordination of complex care. Third mechanism, which mentioned in many papers, is culture change. Policymakers, particularly in the UK, place some faith in IT as a way of improving care coordination. We found that IT only has this effect provided it's well designed to suit the working practices of the health workers who are going to use it. Fifthly, the fifth mechanism is care planning at the level of the individual patient, so that each patient has a plan describing how care is going to be coordinated across the different providers, different individual professionals, and maybe informal carers and family as well that are going to be involved. Some final thoughts from all this. For people who have multiple complex chronic care problems, primary care has firstly become equivalent to a great deal more than just primary medical care. Secondly, the organisation of separation of primary medical care from all those other services which you see in many health systems is increasingly becoming an obstacle to care coordination for this care group. So, thirdly, it appears to make sense that in order to improve care coordination, we ought to be working towards trying to minimise and reduce the number of inter-organisational boundaries. For example, by combining where possible primary medical, nursing, therapy, mental health and social care in a single organisation. And this leads us to the final thought. Perhaps integrated care implies integrated organisations.